Hello students, welcome to PW FMT recall session. In this session, we are going to discuss forensic medicine and toxicology questions asked in NEET PG 2023. As we discussed in PW Sprint, forensic medicine is one of the very important subject and it is a scoring subject. This year NEET PG exam, they asked about 12 to 14 questions from forensic medicine. Let me start with the question number 1. A 5-year-old child with a history of perianal pain brought to OPD. On subjecting the specimen from perianal region, it produces yellow needle crystals of spermine picrate. Yellow needle crystals of spermine picrate. What is the test done? There are 4 options: Barberio, Florence, Takayama test and Teichmann test. Remember, spermine present in prostatic secretions combines with the picric acid used in Barberio test. It forms yellow needle crystals. So your answer should be, that is Barberio test. Remember Barberio, it's very commonly asked in INICET exam also. There is a formation of yellow needle shaped crystals. Because of spermine picrate, the reagent used is picric acid, yellow color. Florence. Florence is also a test for seminal stain. In Florence test, there is a formation of dark brown rhombic crystals. Dark brown rhombic crystals. And Takayama and Teichmann test, they are the test for blood stain. They are the confirmatory test for blood stain. Pink feathery crystal, they are formed in Takayama test. Okay, brown color rhombic crystal, they are formed in Teichmann test. So answer for this question is Barberio test. So as we discussed, so this question was discussed in PW Sprint. Question number 4. It is the repeat question asked in NEET PG 2023 and the same question was asked in the exam. It shows the importance of PYQ, previous year questions. Okay? Yes. Now let me discuss some important points about the seminal stain. What are the tests for seminal stain? The mnemonic is A, B, C, D, E, F, G. What is A for? Can you guess? A for acid phosphatase. That is one of the common tests for seminal stain. And one more A, ammonium molybdenate test. Ammonium molybdenate test that detects the phosphorus present in the seminal stain. Okay? And both are the test for the seminal stain. B for Barberio. Barberio that we discussed already. C for, can you guess C? C for creatinine phosphokinase test. Or C for Christmas tree staining. So both are the test for the seminal stain. In fact, one of the confirmatory tests for seminal stain is presence of spermatozoa in this specimen. That is the confirmatory test among the all tests. D for dehydrogenase. If they ask you an exam, upcoming exam, most specific biochemical test, your answer should be lactate dehydrogenase test. And one more question, how to detect dry semen? So dry semen can be detected with the help of UV rays. It forms bluish white in color. Why bluish in white color? because of the flavin and conjugated choline protein present in the seminal stain. E for as you know, it is ELISA test. F for Florence test, we discussed already. Remember, in Florence, there is a formation of choline iodide crystals. There's one more test, start with the F, fish, that is fluorescent in situ hybridization technique. Lastly, G for glycoprotein P30 test. It is one of the common tests used nowadays in detection of seminal stain. Is it clear? Yes. Now, the question can be asked as an image-based question, that is known as IBQ. Can identify all this IBQ? 1, 2, 3, 4 and 5. What is this? Yes, the one, picture number 1, dark brown rhombic crystal. Yes, you are right. It is a Florence test. Florence. Picture number 2, yellow needle shaped crystal, Barberio test. Image 3, that shows pink color, which is nothing but glycoprotein P30 test. Glycoprotein P30 or acid phosphatase test. And picture number 4, that shows spermatic head, you can see here, which is the confirmatory test. Okay. And picture number 5, that shows dry semen. So you can use Wood's lamp. When we examine the stain under the Wood's lamp, you will see bluish white discoloration. So that confirms that it is seminal stain. All this can be asked. And remember, here victim age is 5 years. So that is also very important MCQ. Remember, for medico-legal examination, in case of victim of rape, the consenting age is 12 years. That can be asked in upcoming exam. Okay. And sodomy is also punishable under 377 IPC. That can be asked in upcoming exam. Yes. Let's start with the second question. Second question, this also we discussed in PW sprint. The question was about heat stroke. You can see here a daily wage laborer who was working in field in hot weather. There is a loss of consciousness. Body temperature more than 106 Fahrenheit. Which of the following least likely present? Least likely. Again, it is a repeat question, and this was question number 3 in our revision classes. So hypotension, that can be seen. Tachycardia, that is seen. Hot skin, yes. Loss of consciousness, yes. Sweating. The sweating is absent in case of heat stroke, according to K.S.N. Reddy, 35th edition, chapter name Thermal Death. Let me discuss few points about heat stroke. So what are the features of heat stroke from standard textbook? Anhidrosis, loss of sweating, delirium, seizure and coma because of the heat stroke, renal failure, hepatocellular necrosis, hyperventilation, pulmonary edema, DIC. One of the important manifestation is DIC. The DIC will cause hemorrhages. It can be hemorrhages in the heart, hemorrhages in the gastric mucosa also. Let me discuss one important case of heat stroke death. Here, a 45-year-old female who died due to heat stroke. During postmortem examination, what I found there are multiple hemorrhages. You can see here. You can see the hemorrhages over the heart, hemorrhages, subendocardial hemorrhages, and also you can see here gastric mucosa that shows hemorrhages, and also you can see the mouth and also lips, so they are dry because of the heat stroke. So DIC can lead to hemorrhages, so that can lead to death of the person in case of heat stroke. It's a very important topic, you must know in detail. Question number 3. Again, Datura is something very commonly asked. Here a question was about a child. While playing, there is a consumption of some unknown substance. Patient came with a history of restlessness. Restlessness. What is restlessness? Restlessness can be delirium. Painful swallowing. That is known as dysphagia. I know. Photophobia. Diplopia. Not able to pass urine. That is nothing but anuria. I think in exam this was the word given, anuria. So all this go in favor of Datura poison, which is a well-known deliriant poison. Okay, so answer is Datura, and the drug of choice in Datura poison is physostigmine. Physostigmine. You can see here this we discussed in PW Sprint. Pralidoxam is not used. Yellow oleander, no. Yellow oleander is a cardiac poison, so there can be signs and symptoms of arrhythmias. Okay. Yes. Now let me discuss some points about Datura poison. See, Datura is a deliriant. What do you mean by deliriant? Disturbed consciousness. What is the fatal dosage? That can be asked in INICET exam. So your answer should be 1 gram, 100 to 125 seeds. Fatal period 24 hours. Remember, Datura seeds, they contain some traces of hyoscine, hyoscyamine and atropine. So Datura poison is equal to atropine poison. So let me write here. So Datura poison is equal to signs and symptoms of atropine toxicity. There was a question about atropine toxicity also in the exam. All these signs and symptoms can be remembered with the help of mnemonic 9D manifestations. 9D. What is 9D? Dysphagia, dysarthria, dilatation of blood vessel, diplopia, dry hot skin, drunken gait, delirium. Delirium, remember, muttering delirium. There is one more important finding, carpologia. Carpologia is a type of delusion, a hallucination that can be seen in Datura poison. The patient will be doing like this, pulling the imaginary threads from the fingers. Drowsiness, dryness of the mouth. Treatment, gastric lavas, physostigmine, pilocarpine. And here there are two more MCQ here. You must know this. One is the Datura fruit. Datura fruit is known as thorn apple. Thorn apple. Okay, why? Because of spiny projections over the fruit. And you can see the bell-shaped flowers. And Datura seeds are, all these are Datura seeds which are double-edged, dark brown in color. They resemble like capsicum seed. Dear student, you must know difference between Datura seed and capsicum seed. So that can be asked in upcoming exam. Okay, so Datura seeds, it is taken from KSN Reddy, 35th edition. Datura seeds are large and thick. They are kidney shaped, dark yellowish brown. Dark yellowish brown. Margins double-edged at the convex border, laterally compressed. Numerous small depressions are present. Smell odorless. Taste is bitter. On section, embryo is curved outward at the hilum. So this is asked in one of the INICET exam. But in capsicum seed, embryo is curved inward like a figure, that is 6. So this is the datura seed and this is the capsicum seed. Capsicum seed. And remember, capsicum is also a very important question. So hewn hand, that is asked in one of the exam. Hewn hand is caused by, that is capsicum seed, which is a dermatitis caused by capsicum seed. Yes. Look at this. So this is datura seed and this is the capsicum seed. You can see the inward like a figure 6. Yes. Now, question number 4. Question number 4, it was a question about organic irritant. A farmer was sleeping in agricultural field. So in his agricultural field, presents with redness, swelling, bruising, excessive uncontrollable bleeding. See here, excessive uncontrollable bleeding, that is because of increased clotting time or increased bleeding time. All this because of DIC. So there is a DIC, disseminated intravascular coagulation. And also there are blisters. Severe pain, tenderness at the site of bite. It is one of the important feature of snake bite, hemotoxic snake bite. He saw something moving away, that means it must be snake only. Your answer should be viper bite. As we discussed, viper, they are hemotoxic. They are having triangular head, constricted neck, broad body and pointed tail. We discussed in our classes. Scorpion bite, yes, scorpion bite can lead to severe pain, very severe pain, but death is very rare and blisters also very rare. So there will be signs and symptoms of increased levels of adrenaline and noradrenaline, that is not given in the question. So it is not scorpion bite. Cobra bite, see, cobra bite presents with the ptosis, broken neck sign and other signs of neurotoxicity. So it is not the cobra bite. Wasp bite, no. Answer should be, that is viper bite, which is hemotoxic. That is what we discussed in PW sprint question. Okay. So reference also taken from standard textbook case and Reddy. So it says that blisters, pain at the site, hemotoxicity, uncontrollable bleeding, all this go in favor of viper bite. So viper can be Russell's viper, it can be saw-scaled viper. One which is present here is the saw-scaled vipers. Saw-scaled viper. The signs and symptoms are, you can see the standard textbook, lines, local pain, local bleeding, bruising, and very important here is the hematuria, gum bleeding, systemic, spontaneous hemorrhage. So that is what given in standard textbook case and Reddy. So your answer should be, that is viper is the correct answer, no doubt in that. Next, scorpion bite. So scorpion bite is also very commonly asked nowadays. Scorpion bite, remember, scorpion venom stimulates adrenal gland, that causes release of adrenaline, noradrenaline from the adrenal gland. One of the antidote given, so that is progocin, asked in INICET exam. Physiological antidote of scorpion bite, your answer should be progocin. You can give dobutamine also, because scorpion can be cardiotoxic also, it can be hemotoxic also, it can be neurotoxic also. So venom, it is stronger than the, fatal than the snake venom, but the amount of venom that is injected is very, very small. And the very important finding is the pain is the very important finding. Yes. Next, question number 5. I think question number 5, it was about the food poisoning. Last NEET PG exam, there was a question about Argemona mexicana. This year, there was a question about latheriasis. A farmer presents with a history of successive crop failure. So here is the clue is crop failure. So, and progressive spastic paraparesis. So all this go in favor of upper motor neuron lesions, gait instability, go in favor of latheriasis, And the answer for this question is beta oxalyl aminoalanine, BOAA. You can see here, this is the Lathyrus sativa seeds. So which contain this toxin which causes neuroparalysis. So answer for this question is A is the correct answer. Aflatoxin, no. Strychnine is a spinal poison, so it presents with the signs and symptoms of tetanus. Remember, strychnine also question asked in the exam. Ergotoxin, remember, so it can lead to Saint Anthony fire. So it produces some other symptoms, not the symptom that is given in the question. So answer for this question is A. So this was the question about strychnine poison we are talking about. Again, this we discussed in PW Sprint. A 44-year-old man developed a generalized muscle spasm, arching backwards. That means it is opisthotonus. You know, opisthotonus, pleurosthotonus, rhizus sardonicus, lockjaw. All these are the findings in tetanus poison. So one poison which resemble like tetanus, that is answer should be strychnine poison. So datura, no, not the answer. Strychnine poison, that is the very good answer, correct answer. Abrus seeds, abrus, remember it presents with some other findings, not the classical features of strychnine poison. Castor also no. Castor, there will be hemorrhages, inhibition of protein synthesis and all. So that is not the answer. Okay, and look at this. Spinal poison. So spinal poison, strychnine is very commonly asked in the exam. So you must know what is that spinal poison, that is strychnine. What is the name of the plant? Nux vomica. It is also known as dog button cuchilla. So what is the fatal dosage? It can be asked in the exam, upcoming exam, 30 to 100 milligram, 1 to 2 hours. You can see here, this is Nux vomica seed. My dear student, what is the taste of Nux vomica? Can you tell? Nux vomica, what is the taste? Yes, Nux vomica, vomiting. Yes, you got the answer. Bitter taste. So it is bitter in taste. So remember, that's why it is bitter in taste. It is not an ideal homicidal agent. Strychnine can't be an ideal homicidal agent because of the bitter taste. Next, some question can be asked. Mechanism. What is the mechanism? The mechanism is postsynaptic. Postsynaptic inhibition of glycine in the spinal cord, which causes increased activity of glutamate, that leads to signs and symptoms of tetanus, opisthotonus, pleurosthotonus and other features. Rhizus sardonicus, which is known as devil's smile. Principle, very well mnemonic in my classes, BSNL. BSNL. What is BSNL? That is the principle of spinal poison, strychnine. So B for brucine, S for strychnine, N for Nux vomica, L for loganin. So if the question asked in the exam, what are the toxic principles of Nux vomica? BSNL, brucine, strychnine and loganin, all these are the principles of spinal poison. Resemble like tetanus. It resembles like tetanus. But remember, tetanus is presynaptic. Strychnine is postsynaptic inhibition of glycine. Clinical feature, there will be conscious seizures, contraction and relaxation. So there is a contraction, relaxation, contraction, relaxation in case of strychnine poison. But in case of tetanus, there will be spastic contraction of all the muscles of the body, and the lockjaw, fever are the other features. Blood tinged froth, that can be present because the cause of death in strychnine poison is respiratory paralysis. So any condition which leads to respiratory paralysis like OP poison, opium poison, so there will be blood tinged froth that can be asked in the exam. And there are two tests are there, Winzel test and Sonistine test. So that you must know, that can be asked in your upcoming INICET exam. Treatment. So treatment is short-acting barbiturate. Okay, and there can be one more finding, postmortem caloricity. This postmortem caloricity also was the question in your exam NEET PG 2023. Yes. Now look at this. I'm asking you, what is, can I identify this for image based question? What is A for? A for, that is abrus. We can see here black, red color, attractive Rathi seeds, nothing but abrus precatorius. You can see double-edged seeds, datura seeds. You can see here Naxomica seeds. And what about C? What about this? Anyone can identify? What is this? Yes, shiny seeds used in umbrella mortar case. What is that seed known as? So this seed is known as resinous seeds. Ricinus communis. Ricinus communis, the active principle resin, which inhibits protein synthesis. It is the agent of bioterrorism, category B, bioterrorism. So which inhibit the protein synthesis, hemorrhages in brain, liver and death in 3 to 4 days. So this can be asked in the exam. It is also known as castor seed. Castor seed. Next, type of autopsy technique in HIV positive dead body. HIV positive, that means infected dead body. So in infected dead body, COVID positive, HIV positive, hepatitis B positive. So to prevent the transmission, so we do some technique known as in situ dissection. Okay, in situ dissection. Anyone can you guess what is that in situ dissection technique? Yes, in situ dissection technique. So that is Rokitansky technique. That is the correct answer. Again, there was one more question about the autopsy technique. Let me discuss about that. Type of autopsy technique in which en masse removal of organs, en masse removal from tongue to prostate, all the organs are removed en masse. What is that en masse technique known as, which is known as best technique? Your answer should be Lay technique. The same question asked in exam. Most common technique, Virchow technique. If they ask you organ block technique, that is known as Gone technique. So let me discuss about the techniques briefly. So the mnemonic to remember techniques of autopsy is Ram Gopal Verma L. R for Rokitansky, G for, that is Gone technique, V for, that is L for, that is Lay technique, Virchow technique, V for Virchow technique. Yes, look at this. So this is the one technique where we remove all the organs one by one. Like kidney removed, heart is removed, lungs are removed, organs are removed one by one. This technique is also known as one by one organ removal technique. So this is nothing but Virchow technique. Remember Virchow, it is the most common technique. Second, you can see in the second, there is a removal of organs in the blocks like cervicothoracic block, abdominal block, pelvic block. So this organ block technique, sometimes some book is en bloc technique. This is known as Gone technique. Gone, organ gone technique. So what are the three blocks? Cervicothoracic, one block. Second, abdominal block. Then pelvic block. So three blocks. You can see in the picture, lungs are there, heart is visible, mediastinum is visible. So this must be cervicothoracic block. Next, you can see here, next picture. In this picture, you can see prostate and tongue. You can see here tongue and also to the prostate. So tongue to prostate, all the organs are removed at a stretch, which is known as Lay technique. Lay technique, which is the best technique among the four. The last one is Rokitansky technique. So Rokitansky, already we discussed in situ dissection of organs inside the body. So especially in HIV, hepatitis B positive. So there were two questions from organ evisceration techniques. So this you must know. This we discussed in our classes. During post-mortem examination, dead body rectal temperature. Remember, it is also known as algar mortis. Post-mortem cooling known as algar mortis, right? So the preferred site is the rectum. Rectum temperature is more than 39 degree. What happens normally after death, body temperature decreases, but here body temperature increases. What is that known as? Basic concept, that is known as post-mortem caloricity. Post-mortem caloricity. Post-mortem caloricity seen in which condition? Cyanide poison, remember, there can be hyperthermia, but that is in living person. But here question about a dead body. Intra-abdominal hemorrhage? No. Corrosive poison? No. Your answer should be septicemia, correct answer. In septicemia, septic shock. So there can be post-mortem caloricity. Let me discuss one or two points about this. What is post-mortem caloricity? We discussed about that. What are the causes? Sunstroke, heat stroke. Tetanus. So tetanus, tetanolysin and tetanospasmin. So that causes spastic contraction of the muscle. Spastic contraction of the muscle. So that leads to post-mortem caloricity. Strychnine poison, same mechanism. Septicemia, pontine hemorrhage. All these are the examples or the causes of post-mortem caloricity. Now move on to the question number 10. Question number 10 was about criminal abortion. IPC 314 in relation with criminal abortion deals with which of the following? So as we discussed in our classes, criminal abortion, CAB. Can you remember CAB? Criminal abortion, CAB. C, that is the third alphabet. 1, 2 IPC. So 312, 313 and 314. 314 IPC. So they are related to criminal abortion. Okay. What is 312? So 312 criminal abortion with consent. 313 criminal abortion without consent. 314 criminal abortion with the death of the pregnant. So answer for this question is C is the correct answer. So criminal abortion, MTP Act, both are very commonly asked in the exam. Last INICET exam, there was a question about MTP Act. NEET PG exam, MTP Act. So this year the question was about the criminal abortion. So abortion, you must know legal aspects. Yes, what is abortion basically? What is criminal abortion? What is abortion legally speaking? Yes, can you guess? Legally speaking, abortion means expulsion of contents of conception before full term. This was asked in somewhere around 5 years back, this question asked. Before full term. What are the abortifacients? That is also asked in the exam. You must know abortifacients. Abortion stick, very commonly asked. Lead oleate, calotropes, all these are abortifacients. Local violence also can be lead to criminal abortion. Cupping, that can be asked in the exam. Okay, abortion wine, that can be asked in the exam. So what is criminal abortion with consent? 312 IPC. And without consent, 313 IPC. That's what we discussed in previous slide. Pregnant death, 314 IPC. This is very commonly asked. You must memorize all the 3 IPCs, so that can be asked in the upcoming INICET exam. Next, question number 11. The question number 11, it was about the intracranial hemorrhages. A 76-year-old man presents with increasing somnolence, lethargy, there is a headache, mild nausea but no vomiting. But here important clue is hemorrhage that crosses the suture line. Your answer should be, all of you, SDH. SDH is the correct answer. That is because of bleeding from bridging veins. In extradural hemorrhage, there is a bleeding from middle meningeal artery. SAH, there is a bleeding from berry aneurysm. ICH, middle cerebral artery. Your answer should be, that is SDH. Okay, SDH, EDH, all these are very commonly asked image based questions. You must know in detail about that. Now, question number 12. In case of aspirin poisoning of 100 tablets, so aspirin, that is salicylate poison, what is the treatment? Remember, in aspirin poison, so there can be lactic acidosis. There can be lactic acidosis. Why lactic acidosis? In aspirin poison, there can be lactic acidosis because of inhibition of function of Krebs cycle. There can be respiratory alkalosis. There can be respiratory alkalosis. Why there is a respiratory alkalosis? Because aspirin inhibits the higher centers of the respiration. That's why hyperventilation and respiratory alkalosis. Next, there can be tinnitus. So why tinnitus? Because it affects the 8th nerve. So all these three symptoms were given in the exam. So that go in favor of aspirin poison. In aspirin poison, what is the treatment? We do gastric lavage, we do hemodialysis, we do peritoneal dialysis. So desferoxamine, that is used in iron poison, that is asked in last INICET. No. Atropine is given in OP poison. No. N-acetylcysteine given in paracetamol poison. No. Your answer should be B is the correct answer. No doubt in that. Alkaline diuresis by IV sodium bicarbonate. So that is the better answer for this question. So B is the correct answer. So just a recap of all the signs and symptoms of aspirin poison, because last NEET PG there was a question about iron poison. So this year aspirin poison. So there is a ring. The ring nothing but tinnitus. Why tinnitus? Affects the 8th nerve. Hyperventilation lead to respiratory alkalosis. So there can be metabolic acidosis, seizures also. So the treatment is, we discussed already, hemodialysis, peritoneal dialysis. So gastric lavage also can be done. So and also that is sodium bicarbonate. So that is about aspirin. Question number 13. So this animation was not given. Animation. You can say alcoholic here just to help you out to remember the things. So a chronic alcoholic presents with confusion. Confusion, ophthalmoplegia, ataxia. Remember, global confusion, ataxia, ophthalmoplegia, mnemonic is GOA. Global confusion, ophthalmoplegia, ataxia. All this go in favor of vitamin B1 deficiency. That is nothing but, can you guess all of you? Wernicke encephalopathy. Wernicke encephalopathy, correct answer. Run amok is not the answer. Run amok seen in chronic cannabis poison, which is an impulse disorder. Korsakoff psychosis, there will be confabulation, that is not given in the question. Delirium tremens, there was a question about delirium tremens. So that was also one question was there in the exam according to my sources, my students. So answer is Wernicke encephalopathy. Please remember, my dear students, so you remember GOA, G-O-A. Global confusion, ophthalmoplegia, ataxia. While occur, this is because of vitamin B1 deficiency. So vitamin D1 deficiency causes beriberi also. Okay, next. So Wernicke encephalopathy characterized by some important features. So the criteria known as Kane criteria, altered mental status, acclimate abnormalities, cerebellar dysfunction, dietary deficiency. The The treatment is thiamine. Korsakoff psychosis, that is characterized by memory impairment. There can be antegrade retrograde amnesia, confabulation also present. Yes. Question number 14. So the question number 14 was about organophosphorus poison. So in case of organophosphorus poison, treating doctor noticed that during management of atropine and oxime, patient has become hyperthermic. So this hyperthermia because of atropine fever. So your answer should be atropine toxicity is the correct answer. Okay. It is not organophosphorus poison. It is not oxime toxicity. So aspiration pneumonia, no. Your answer should be atropine toxicity is the correct answer. My dear students, OP poison is a very common DS topic in your exam. You must know in and out of that. Let me discuss only 1 or 2 minutes about this. So mechanism. What is the mechanism of organophosphorus poison? Which causes irreversible inhibition of acetylcholine esterase level. You know, acetylcholine esterase level, irreversible inhibition. Carbamate causes reversible inhibition. This organophosphorus causes irreversible inhibition of the acetylcholine esterase. What is normal level of this enzyme? 4,000 to 10,000 international units. So that is the normal level. Fatal dosage. You know, organophosphorus can be 2 types, alkyl phosphate, aryl phosphate. Remember, malathion, which is a alkyl phosphate, that can be asked in your upcoming exam. Malathion 1 gram. Parathion 175 milligram. 175. 1 drop of parathion can lead to death. Okay. So that is known as 1 drop syndrome. So that is parathion is very toxic. Clinical features, very old mnemonic, sludge match, salivation, seizure, sweating, lacrimation, urination, diarrhea, gastric upset, emesis, meiosis, tachycardia, cramps, chromodacruria, red tears, hypertension. All this because of increased acetylcholine level. If there is an increased acetylcholine level, so that leads to all these signs and symptoms. They are known as muscarinic symptom or nicotinic symptoms. So this can be asked in your exam, very commonly asked. Treatment, what is the drug of choice? Atropine. What is the therapeutic endpoint? That can be asked. But carbamates, also you must know carbamates, so poison. So you must avoid oximes. That is also asked in the exam. So atropine, drug of choice. Then palm dam given. Prolidoxime and diacetyl monoxime. Diazepam, that is for seizure. And prolidoxime is contraindicated in carbamates because they have some activity of acetylcholine activity. They should be given within 48 hours before aging of the enzyme. Postmortem finding. Postmortem finding. So there will be CPC present. What is CPC? What is CPC? Cyanosis, congestion, petechial hemorrhages. Kerosene-like smell. Kerosene-like smell is seen in, that is asked in NEET PG exam. Kerosene-like smell, not seen in kerosene poison. Kerosene-like smell is seen in case of organophosphorus poison. Froth, which is blood tinged froth. So one of the differential diagnosis of froth in drowning is organophosphorus. Jamaica ginger paralysis is a well-known case of organophosphorus poisoning. So that's it about the forensic medicine questions asked in NEET PG 2023. I discussed all the 14 questions with the answer and also other options, also some related concepts around the question. So wish you all the best for upcoming INICET exam and other exam. Thank you.